So I thought we'd start today by just explaining briefly what rural and remote health is. So rural and remote health is healthcare that is delivered outside of a metropolitan or regional area. And as you can see by this Australian Bureau of Statistics map, it's quite well done. The yellow area is your very remote area, and it's quite significant. The darker areas are your major cities, and then it goes lighter as you go out. So it's quite a huge area. Next slide, please, Tony. So we thought the objectives of today would be best to work through real life challenges facing Mito community members who live in rural or remote location. There's been two common challenges that have been identified. First one being accessing health professionals, allied health, GP, specialist. And another one is how to get the most out of a telehealth appointment so you feel confident in booking, planning and making a telehealth appointment. Next one, Tony. So to do this, we thought I would bring it back to a case study. Now, so introducing Gail. Gail was 55 when she finally received a diagnosis of Mito disease, has sensory loss fatigue with major muscle issues. She lives 300 kilometres from the nearest hospital. Her GP was great, but hard to get an appointment with. All the tests being organised were hard to access. There were no specialists based in her local town. And she had expressed that she's got 3 specialists to see, which is not unusual. It was getting harder and harder to get daily tasks done at home for Gail. Next one, Tony. So the challenges voiced by Gail included infrequent appointments and difficulty getting appointments with her GP, a lack of knowledge around Mito from her health professionals, remembering that GPs are mostly generalists. They may have heard of Mito or might not have heard of Mito. Unable to access health services when Gail needed the most support, no specialist based locally, health symptoms making it difficult to travel to her appointments, and this is something that can't be overlooked. Not able to access sufficient home support. Next one. So now Gail decided to try to find another GP as hers was retiring and closing his practice. She started with her primary health network and learned very quickly that the area she lived covered 1 million square kilometres. So the primary health network then gave her the number of her local health network and also a list of GPs around the area. So that was just a starting point. Then we checked the Mito professional directory and were able to locate a couple which had the same names from her list, and then started the process of phoning those GPs and finding which one was going to be the best for her. Gail ended up picking one, even though he turned out not to be in the same town as her. She decided that he was going to be the best for her. So finding a GP, starting with your primary health network, as I just said, had been beneficial for Gail. Find out who is listed on the Mito professional directory is another way to find a GP. However, changing GPs is not always the best way forward. With a willingness to learn, they can use the Mito Foundation's resources to learn more about Mito, as Tony had talked about earlier. Next slide, Tony. So some of the supports for GPs may be online education modules. Maybe it's Mito and managing Mito. Printed resources. We also have a list of Mito specialist clinics, which is on our website. Links to the telehealth service and also links to our Mito professional directory. Next one, Tony. Now, Gail connected with her nearest Mito specialist clinic, who helped her link up with 2 specialists at her local district hospital. A third specialist proved a little bit difficult. However, we were able to identify one through the Mito professional directory. And it was found this particular visiting specialist was found to be visiting at a nearby GP rooms. So Gail was able to make appointments there. Transport to the hospital was organised through a community transport service, and Gail opted for her first visit at the district hospital and then decided she was going to try telehealth. Next one, please, Tony. Finding a specialist. Medical specialists visit rural towns several times each year in clinics and in private rooms. So contacting the specialist, though, before the visit to discuss the requirements for a consultation would be greatly recommended, as there may be a fair bit of preparation before you see the specialist. In Queensland, there is nurse navigation services, which can connect you to health districts and local health services. Contact your local primary health network is another way. Also, contacting your district hospital, outpatient clinic or department, and find out if they have any visiting medical specialists. That can sometimes be of great benefit. The Aboriginal Health Network teams often have visiting specialists with Aboriginal and Torres Strait Islander people can access. Use Health Direct. Health Direct is a great resource when trying to find a specialist. And telehealth now is an option with your specialty appointments. Next one, thanks, Tony. Now, Gail struggled also to find a team of allied health workers to support her. She required physio, exercise physiology assessment and speech therapy, and will require occupational therapy assistance later on. We ended up finding a physiotherapist through Choose a Physio, the Australian Physiotherapy Association. This physio turned out to be experienced in rehabilitation and chronic muscular disease and understood exercise intolerance, which was going to be of great assistance to Gail. He had no knowledge of Mito, so however, he was willing to learn. So that would be able to be added to as he saw Gail, and definitely I will continue to work with him to help with his education. And this physio knew of an exercise physiologist, so that was great. That helped that process happen. The physio could see Gail at home weekly, and the exercise physiologist could do a virtual call monthly to help with the exercise planning. The support worker was trained by the physio to help with general exercises between these visits and between these consults. The speech therapist was recommended by her neurologist. Alternately, we could have used speechpathologyaustralia.org.au. These appointments were by telehealth with the speech pathologist. Gail has had a couple of appointments and they have turned out to be quite beneficial. Now, next one, please, Tony. Allied health services. Allied health are non-nurse, non-physician care providers such as speech therapist, occupational therapist, and exercise physiologist. So sometimes you'll hear that term used quite a lot. Finding an allied health professional, first place to start is with the National Professional Association for that particular discipline. So going to the website, and most of them have a how to find button, and you just type in the postcode, and this will create a list of practitioners. Then the work starts with trying to find the right practitioner. Using national contacts such as Health Direct, which is your National Health Service Directory, My Aged Care. I have used Dementia Behaviour Management Advisory Service before as well, and they were able to guide us into the use of allied health services, and also disability services can also be of help. Local contacts, GP, primary health networks can also help find an allied health personnel. And also community health centres and hospital local health services have info about their allied health staff and may be able to help you link you to private allied health services. Next one, Tony, please. Now, Gail decided to use telehealth and has had a couple of telehealth appointments, one with the specialist and one with her allied health team. Both have turned out to be quite successful. Gail was very reluctant at first. She needed quite a bit of preparation to prepare herself for the telehealth appointment. But after the appointments, she is now developing quite a bit of confidence in using them. The advantages of telehealth are numerous. Telehealth can improve your continuity of care. They are convenient, of course, because you can have them in the comfort of your home, or if it's not in your home, then it certainly can be at another service. They reduce the risk of illness transmission and also improve access to care, especially if someone has mobility limitations and if there is no easy access to a rural and remote health service. Tony, next one. Now, just a couple of extra pointers. If your doctor or medical centre doesn't offer telehealth consultations, you can use Health Direct to find a provider. And there is another website, the Australian Digital Health Agency has quite a few videos on their website about how telehealth works and how you can make it work for you. And also a very important point to remember is that if your internet is poor, you can book community centres, libraries, GP rooms for a specialist consultation, and libraries and community centres for a consult. The only thing to remember here is you do need to notify the community centre or library of what will be occurring, because they need to assure that you'll have privacy and that you'll be able to have internet available to you. And they also can provide you with help linking up the service. Next one, please, Tony. Oh, these are just some lists of services which I've mentioned throughout this short presentation. If you would like to know about any of these, I can certainly guide you with some information. And the next one, Tony, I think that's, and that's just a list of services. This is just your patient transport services that are provided in different states. New South Wales, it's actually your IPT AAS service, which can give you financial assistance for if you live remote, travelling to your medical appointments. And in the other states, that's what they're known as. So thank you very much for listening today.
Welcome back, everybody. Hopefully you had a little refreshment. The next part of our agenda is our second speaker. So I'm really pleased to introduce Rachael MacKinnon. So Rachel's recently commenced in the NeuRA service, which is pretty new in itself. As a clinical nurse consultant, neurodegeneration services, with a history with Parkinson's disease, and now has joined the mitochondrial disease space. And from our conversations, is learning a lot, which is fabulous. So welcome to the mitochondrial disease space, and welcome to today. Thank you so much for coming along and sharing your knowledge and expertise with us. So Rachael has 30 years of nursing experience working in a variety of settings, from neuroscience patients in acute care to community health, and has experienced the benefits of telehealth working in the Mid-North Coast as a great modality of care for her Parkinson's movement disorder patients, linking regional patients with metropolitan neurologists, up to COVID-19, which I think changed things significantly. So today, Rachel's going to talk to us about telehealth and how you can make the most of those appointments. Thank you, Rachel.
Thanks so much, Danny and Michelle. Um, yeah, so it's been pretty amazing starting at NeuRA, working in the mitochondrial space, of which I just want to say I'm on a very steep learning curve. Yeah, but I guess I've had the benefit of actually working with patients in a regional area where specialist services aren't available and how we use that to the max. So I hope that I can translate that into patients with mitochondrial disease. So, um, just I'll talk about that, talk about how you can rethink your consultations with your consultant or healthcare providers. What are the telehealth and digital options? What sort of hardware and software do you need? How you prepare for your telehealth appointments? And then there was a question I was asked about pediatric versus adult appointments. I'm not that well versed in pediatric care, but I did actually poll a few doctors to see what they thought about using telehealth with children. So I'll share that information. My story was that I moved from Sydney up to Port Macquarie to become a Parkinson's disease clinical nurse consultant. In my job interview, I didn't actually ask whether there were specialist movement disorders people there, and guess what? There weren't. I didn't realise that was the case. I just thought there was specialist services everywhere. That's the metropolitan centric version I had of the world. So essentially, my role was I started up in a new service and I saw patients, at their homes, in aged care facilities. I had my own nursing clinic. I saw people in emergency departments and in the hospital, but then my services actually sort of broadened, and the pictures of the cows and the number of gates that I actually opened and closed. I was not good at opening and closing gates. But I learned how to do that. I really struggled with that. And there was actually some consultations that I did with patients actually in paddocks. And that's when I discovered the belted Galway cow, which was my favourite cow working up there. But I also did a telehealth consultation with a patient that was actually working in a dairy farm. So I guess the message about that was that we took the service to where people lived. And I think that there was a lot of benefit in that. So even one day I was working in Port Macquarie, I tuned into a telehealth service with a metropolitan doctor, and we did that appointment. He had some other patients to see face to face, and I jumped in my car and I drove 40 minutes to Kempsey and went to the house of an elderly lady who couldn't actually get out of a house, and then dialed up and we did our telehealth service there. So it was pretty good service, I thought. How did it happen? I was really fortunate at the time because my old nursing unit manager that I'd left St Vincent's for, he was actually the new telehealth manager, which was rolling out their service. My movement disorder specialists were very willing and able to actually participate in those telehealth services without actually seeing the patients first. And I was very, very willing. At that stage, there was a software platform called PEXIP, and that's just a screenshot of what it looked like. So it was pretty easy for me to access for people. So it was really, I guess the point of this was that it was a nurse-led clinic where I could fill the gaps in assessment terms with the consultant at the other end. So that was the version that I was kind of doing. It worked really well. I thought maybe we should look into some research about this and how, is this a really good, what's the best modality of care? Is it good? What was happening elsewhere in the world and in Australia? So I started doing some research about it and got some interesting results. Basically, there wasn't much happening really in terms of telehealth or telemedicine. There was a few things that were going on, but it was interesting. But then, of course, along came COVID. And the other thing that happened was that people in the community, because it was a smaller community and we had a Parkinson's support group, heard that their colleagues or their friends were actually having telehealth appointments, no longer having to drive down to Sydney in a 4-hour car drive. And they also wanted to have telehealth with their neurologist. So COVID, and I actually approached quite a few of those neurologists, and at the time they said, no, we don't like telehealth. We don't think that's a good way to do a consultation. But then things changed when COVID came along, and suddenly everybody was on doing telehealth because no one could travel. So it was kind of fortuitous. So in addition to that, they changed their healthcare platforms into a thing called My Virtual Care. And I gather that to your participants here today, Tony and Michelle are actually around Australia. But so this was a New South Wales health platform. And we sort of looked at what the definitions were. Was this telehealth? What was it? Telemedicine? But essentially, My Virtual Care just meant healthcare that was being delivered that wasn't face to face. And that was the definition. So the good thing about the My Virtual Care was that you could just log on to it. You didn't have to pay for it. You didn't have to have Zoom or whatever. But so it was a good service. And I'm sure if I look at the other states, they all have their own versions. But of course, then along came MS Teams. We did consultations on WhatsApp, and we also did them on Zoom. And I guess the difference between those platforms was that My Virtual Care was meant to be secure and safe in terms of private confidentiality. And you probably know, there's always concerns about how safe and secure WhatsApp are and so on. And if you needed MS Teams, then sometimes people thought that they had to download and pay for them. Same with Zoom, but they're, anyway, that's how it all got. We started becoming very flexible and adaptive to whatever it was that we needed to use for telehealth. Does that make sense? Yep. Okay. So what did people need? I can tell you what, during COVID, everybody, I think the manufacturers of all these devices, which basically means a desktop, laptops, a hybrid of both, tablets and phones, really did a roaring trade. And I think a lot of grandchildren did a roaring trade in helping set up their grandparents, mostly with all this technology. But I spoke to one of my Sydney colleagues and told her on a number of occasions I'd actually gone out to people's places and actually helped them set up their software and their hardware so that they could participate in telehealth appointments. And they always said, oh, that's a bit above and beyond your scope of practice. But I felt that was really important. It made it easier for me too in future. So they would have that ongoing. They knew what to do. It just had to be a click of a link, and they were on to seeing their specialist. So that's what you need. And I think probably most people do have those things now, even an iPhone or an Android phone. They also need to have you've obviously got all this stuff because you're joining in today. So a webcam or a camera and microphones. And that's really the terms of the hardware. You need a web browser, so Chrome or Edge, and sometimes the platforms work. Sometimes the software telehealth work better on Chrome or Edge. Obviously, you need an email address, and if you don't have one, which I'm sure you do, but Google has free, and it says it has the best email, Gmail. Access to a reliable internet connection, and I hope it's interesting, isn't it? Because I think the internet connections that I had up in Port Macquarie and Mid-North Coast were probably even better than where I'm actually currently seated right here in the middle of Sydney and Alexandria, because I've got dreadful internet connection. But I know with the rollout of NBN that should make things easier for people. Using Wi-Fi and sometimes having a wide cable for the internet also works well. Just like we just did then, we did a test run, check your tech before you actually engage in your appointment. Have plenty of time to set up. Good lighting is really preferable too, and having a backup plan. One of the frustrations of people was, and probably my frustration too, was we were actually accessing a clinic, an outpatient clinic, which was actually bulk billed. So I thought that was a pretty good deal as well. But of course, doctors see people, they overbook. And so often I would be sitting waiting for, a scheduled appointment at 3:00, and the doctor actually wouldn't be getting on until 4:00. And so we'd make polite chit chat for the next hour, and people would get frustrated. And I'd say, well, you know what, when you go to Sydney or when you go to your GP, you're often made to wait. So factor that into your visit too, that there may be a wait. That's always been a lot of anxiety induced that, people were sitting there waiting for someone to come on. But I was lucky because I had the phone numbers of the doctors that I was going to connect with, or the physios or whoever it was. And we did a lot of speech pathology too. And I just ring them and just remind them that we were waiting. I think with My Virtual Care, the host knows when someone's actually logged on and they're sitting in a virtual waiting room. So that makes it a bit easier. But for the other ones, I just say, just reminding you that we're waiting. When you're ready, we'll connect with you. And so and inevitably that what would be happen. A private, well-lit area, that's where you won't be interrupted, is always good. But having said that, as I said, I was doing telehealth in the paddock, out of the back of my car and all sorts of places with my patients and connecting to Sydney. So that was that model. They said the doctors felt that worked really well. In fact, they were very impressed with the telehealth that we were doing with St Vincent's, and they said it was a really good model of care. And the feedback was that it was because there was actually it was a nurse-led clinic at the other end. And they often said that trying to do telehealth with the patient without that sort of support wasn't as optimal, but it's still, it's still an option in some cases, because maybe, where you're actually located, you're not going to have that. But it's something that I would recommend if you can. Another model was a Newcastle neurologist. She would try badly, but she did try to actually have the patient sitting with the GP and having their consultation. And I thought that was brilliant, because it actually gave the GP a lot of education about the nature of people with Parkinson's. And I think that would work well with Mito too, because I've just heard you saying, how people don't, most people don't really get the nuances of mitochondrial diseases. So that was a really good model too. The problem with that was there would be, say there was a GP working out at Southwest Rocks, and they were actually the only GP for that particular practice that day. So it was really hard to align the consultant's time with the GP time and bring the patient in. But it did work. If we could get it to work, if the stars align with the moon, it would work, and it worked well. And it was great. It was really good for the GP to be involved in that appointment, because they learnt a lot about, Parkinson's disease, and why the neurologist was prescribing something or suggest or recommending a particular therapy. So lots of different ways, I guess, isn't it? And maybe that can't always be the way. What happens? So once you've made an appointment with the consultant and they've agreed to do telehealth, so typically you'll get an email confirming your telehealth appointment. It's become so much more easier these days after COVID. Everyone's doing it. So this is an email for an invitation to My Virtual Care looks like. It's just got an email: dear patient, your appointment with Dr. Frankenstein has been scheduled with these dates, and please see the link below. And that's pretty much how easy it is. And obviously, find a quiet space and log into the virtual room as late 10 minutes before your appointment, but have your backup plan if things don't go. The backup plan is that actually the telehealth didn't work because the internet connection wasn't stable enough. So we would just dial in and have a phone call with the specialist. Not as good, but better than nothing. I also would make sure that my patients had all their relevant medical reports sent through in advance of that appointment, which is just the same thing as seeing someone, isn't it, really? The amount of investigation and information gathering that goes on before an appointment is pretty amazing and is quite time consuming. So I hope that to make it easier for the clinician that people can actually have all their data and all their information. I say keep them on hand as well, because I used to always send my reports onto the neurologist and had this expectation that they were going to read them before they saw the patient. Not going to happen. They just don't have the time. The number of people they were seeing in different clinics. Like one doctor I was doing telehealth with, he had about 5 different clinics, face-to-face and telehealth. So there was no way he was going to read my reports in advance. So I had to make sure that I had them all together at the same time, ready to share them with him. I'm not sure, how important it is, but a current list of medications was always really good to have. I guess that was also in the Parkinson's space, where medications tend to change like the sands of the Kalahari Desert in the wind. But anyway, having a family member or a carer or a significant other join the telehealth was also useful, if there wasn't the option of having a nurse sitting with you. And of course, just like you're going to do when you're going to see your specialist, is to write down in advance the top 3 concerns that you wish to speak to, because I know that when people get to their appointments, they forget what they wanted to talk about. And anyway, so please write those down and stick to the script so that you do get the most out of your appointment. The very, very first, I thought it was so beautiful. I looked after a lady who lived she lived in the bush out the back of nowhere, and she was pretty amazing. She had a concurrent diagnosis actually of multiple sclerosis and Parkinson's, and she drove all the way up to Port Macquarie to do a telehealth with the body movement specialist, and she had no idea what to expect. And I just remember watching her sitting really nervously in front of the computer screen, and she really didn't know what was going to happen. And then suddenly the doctor appeared, and she just was so amazed by it all. I think that she actually forgot what she wanted to discuss with him, but it was a very beautiful moment for me, and it just made me realize that it's sort of something that you need to learn or be exposed to make it normal, if that makes sense, if you haven't done it. But anyway, she was the one that actually, I think she wrote to her local member, and she got internet access improved in her very, very remote area, because it was really difficult for her to drive all the way to get into town near Taree and then to drive up to Port Macquarie. But she became one of our top telehealth users. With her appointments with her specialist. She was just amazing. But I do remember the very first day and how nervous she was. And I just realized that she had no idea of what was going to happen. Anyway, it went well for her. What are the benefits? I guess I think there's more choice for patients and clinicians as well if you can use telehealth. It's very convenient and does save those travelling long distances and the cost. I think I just listening to the end of your conversation before about the costs of travel to a specialist appointment. One family member had a husband, wife, and a daughter that was a full-time carer for her mum. And they said to me that when they used to come to Sydney to see their specialist, it was the price of 3 airfares, accommodation, meals, and they'd try to stay like one night if that was possible. Driving was not possible for them because of their mum. The mum, it was too hard for her to, and so we worked out the cost, and it was like $2,500 to do a consultation to Sydney. And so that was all, they could claim that on IPTAS, but it was just so much more convenient to do it with telehealth. And I used to love going to see these people too, because they used to always give me pumpkins and tomatoes and stuff out of their garden. I think it connects family carers and patients well, and the social and healthcare providers when we do in the instance of the GP perhaps being tuned into the neurologist. It's equitable, it's timely access to medical services, that you can get appointments and you don't have to plan months and months in advance of how you're going to get to those. And I think, there's a lot of more research now too about the continuity of care when you can engage in telehealth with your specialists in these really, very nuanced diseases. I had the benefit also of the trust from my neurologist who knew me and knew my role, and he didn't insist on seeing new patients face-to-face for the first time. But I think it's probably really important that people don't just rely on telehealth, that you probably do face-to-face appointments, particularly during diagnoses, but that you leapfrog. So you have a face-to-face appointment with your specialist. Particularly, I know with Mito patients that there's a fairly extensive neurological examination that's often required, but leapfrog it. So, things like follow-ups or, reviews can certainly be done well using telehealth, I believe, and that's how they actually do it at NeuRA. So face-to-face versus telehealth. So I guess, face-to-face is always optimal. I think it's, as I was saying, it's really good to have the first appointment with a specialist. There's a lot of non-verbal language that happens in a face-to-face that we don't actually see in telehealth. and if a physical examination is required. So first appointment only by telehealth. Yeah, so if you can, if you can get your GP to sit on your telehealth appointment with your specialist, that would be good. And so with pediatric telehealth, I didn't, as I said, I haven't had any really experience in that. However, I did poll a few people, a few doctors and people about it, and they felt that in the same instance, it's probably better to see children face to face. And get the full essence of what's happening with the children with pediatrics, but possibly follow up or reviews could be done by telehealth. But they've said preferably we'd prefer face to face. So I think too, I would often get my patients to say what worked well for you during telehealth and what didn't work well, and can you feed that back to your clinician? And I guess the most feedback was having to wait for their telehealth appointment and not knowing that they were actually there in the back, not knowing that if they knew that they're actually sitting there waiting for this appointment to happen. But then, it would magically all appear and go beautifully, and all the waiting and the frustration would be forgiven in 2 seconds once the doctor appeared. But anyway, I would make sure, and after a while, I always made sure that people had plenty of, good waiting room magazines to read, and to acknowledge that there often could be a wait for all the other reasons that they might have to wait in a doctor's surgery or a doctor's rooms. So that was my experience, and I was just going to say, for telehealth, we can actually have referrals to me, even though I'm learning all about Mito. There's also lots of good guides on how to use telehealth information for parents and carers, and most local health districts have these guides that you can click on and work out what you need to have in order to prepare for your telehealth appointment, minimum software, minimum hardware requirements. So they're all there. It's become very much a very good modality of care, as they say, just a different modality of service. So that was my experience, and I still enjoy doing telehealth myself with patients that I've met and known, and it's certainly very good for regional places where they don't have the services, and I guess that's pretty much the same for Mito too. Would you agree? I think that's what we've got.
Thank you, Rachel. Very informative.